Hello, this is Jurgen Rasmussen speaking. Welcome to the Provocative Hypnosis Vlog Episode 3. This episode is about hypnotic hallucinations, spatial anchors, and how to tell if someone is a great hypnotic subject. I'm going to show you a live demo that I did at the 2010 Change Phenomena Conference. And what I did there was, in cooperation with a British psychiatrist, evoke positive and negative hallucinations on stage during a presentation. Now, a lot of people who have watched the DVDs from the Change Phenomena Conference and or who were in attendance have been quite intrigued by this particular demonstration, and written to me in emails and private Facebook posts, and commented both on the skill level, and some of the comments have also been about risk, namely, how could I take such a risk? Now, what was different in this particular demonstration, at least from the perspective of many who saw it, was that I invited someone from the audience, and without anything that most people would recognize as a hypnotic induction, I evoked a positive hallucination and a negative hallucination right then and there on stage. And to quite a few people that seemed risky. Like, how could I possibly know that that would work? So let's take a look at the clip, and then I will analyze it and break it down afterwards. So take a look. Okay, so let's look at this. Now, in terms of skill and in terms of risk, there really wasn't that much of a risk, and no, there was no check in the mail. And in terms of skill, the most important skill here was not really skill at hypnosis per se, or language, or suggestions. 90% of the skill in this particular demonstration was just about selecting the right subject. What you need for a demonstration like this is a highly hypnotizable person. Now, depending a little bit upon the criteria that you use and the scales that you use and how liberal you want to be with it, you would probably end up with somewhere between 5, maybe 10, maybe 12%, if you really want to push it, of the population that you could do this sort of demonstration with. Now, for practical purposes, this means that I could not have done this particular demonstration with the vast majority of people. And that is also true irrespective of who's doing the hypnosis. You could put whoever hypno hero you might have on stage. It wouldn't really change anything. So the main thing here is the ability to spot and select a great hypnotic subject. So let's define this. So when I talk about hypnosis and a great hypnotic subject, I'm talking about a state of very focused attention that seems to be characterized by 3 capacities. Now, the first capacity is the capacity for absorption. Being able to step into a suggested experience and make it as real as real. That's the first ability. So if somebody is good at absorption, there's a modest to good chance that they might also be a good hypnotic subject. To put it this way, if they are good at absorption, there's a good chance that they may be a good hypnotic subject. If they're not good at absorption, it's extremely unlikely that the person is going to be a great hypnotic subject. There's maybe a 1% chance. I'm talking about what Wilson and Barber back in the day used to talk about as the amnesia-prone individual. But that's a discussion for another podcast. So if you go to the movies, for example, and you observe people, you'll notice that some people don't really get into the movie. That they're always kind of scanning the peripherals. noticing what's happening around them. Some people, to various degrees, get really absorbed into the movies, and some people get so absorbed into the movie that it's completely real to them. It's as real as real. It's as if they become part of the plot. And some of these people almost they need a few seconds to kind of reorient back to reality, so to speak, after needing some time to discover that they're actually in the movie theater. Those folks are really, really good at absorption. Now, you have dissociation, which is that capacity to do something and simultaneously experience it as completely non-volitional. So, for example, a time back, I did a hypnotic experience with or experiment with two identical twins to test their hypnotizability. And I hypnotized one of them, and I gave him the suggestion that when he came out of hypnosis and he heard me talk about hamburgers, he would feel an irresistible urge to rise up and close the window, that the room would be very hot, and he would almost feel like he was suffocating. And I also suggested that he would have a complete amnesia for having received the suggestion. So later on, after the hypnosis, when me and his identical twin started talking about all sorts of stuff and casually mentioning hamburgers, he started sweating. He got really hot. He started to unbutton his shirt, kind of confused as to what was going on, and he said, I really need to open the window. It's too hot in here. And I started arguing a bit with him and asked him why. And he came up with all sorts of reasons, and me and his twin commented that it was not too hot in there and nothing swayed him. And all the reasons he gave, none of them mentioned the fact that I had given him the suggestion. He had a complete amnesia for acting upon the suggestion. So this is an example of extreme dissociation, and dissociation in relation to suggestion. And the final capacity that we're looking at is suggestibility. Not talking about gullibility or being conformist or being obedient. I'm more talking about that ability to respond to a suggestion. So for example, if I start asking a client about their allergic symptoms and they respond by generating the allergic symptoms, that's an example of high suggestibility. So the people that are deemed highly hypnotizable have a tendency to be able to age regress in present tense. They can act out bizarre post-hypnotic suggestions with a amnesia condition, and they can do positive and negative hallucinations. Now, a positive hallucination is a hallucination where they hallucinate something that everyone else would agree is not really there. A negative hallucination is that they hallucinate something to not be there, that everyone else will agree is actually there. Now, some people might argue that we all do this in real life anyways, that our experience of the world is illusory and it is a hallucination, and that is true. But there's a difference between that and being able to spontaneously do it while being directed through suggestion in relationship to another person. That's really what hypnosis is about. So how did I know that this guy was the right guy to select? Well, the strongest tell was that earlier in the day, my good friend and colleague, James Tripp, did a short hypnotic demonstration where he did a card stick, which was essentially that the guy would be unable to drop a card as a result of suggestion. Now, this many would consider a rather light or easy phenomena compared to, for example, negative hallucinations, and for most people it is. But when I saw this guy do that, I mean, the level of absorption, the level of focus that he had was quite profound. He seemed to completely block out the audience and anything else not relevant to his experience. And after James kind of terminated the experience, notice his sluggishness in responding to external cues. Just like with the movie theater example, he needs some time to actually kind of discover where he is and to reorient back to his common reality. This is a strong tell of high hypnotizability. So when I saw that, I kind of marked that out as interesting. You know, there might be potential here. This might be a guy who I could do some really exciting stuff with. During the lunch break, he came up to me and he introduced himself, and he said he was a psychiatrist who worked with addictions, and he had read my book Provocative Hypnosis and loved it and had a very strong interest in hypnosis. So he had a positive impression of me, and we had instant rapport. Now, that doesn't tell you anything about hypnotizability, but it really helps to have a person who's positively inclined and engaged, especially since it's the client who actually produces the phenomena. You're just bringing the weather, so to speak, or organizing the context. Something else I noticed is that when he started to describe some of his own experiences, he really went there. Like he really went into the state that he was describing. So there was a complete congruence between what he described and his physiological experience. Now, this was another mark of high absorption. So I started to describe some experiences and throw in some suggestions. And when I did, he completely went there. So these were also nice tells. They're no guarantee, but they're nice tells that the person's suggestible and that the person has good capacity for absorption. Now, in terms of being able to do hallucinations in the visual system, I don't think the NLP eye accessing model holds up scientifically. People more or less fit into it. But this guy had very clear eye accessing cues. And clearly he spoke pretty fast, he used a lot of visual predicates, and he had the ability to visualize in consciousness. So in that sense, not that much of a stretch to think that this guy might be able to do some good visual phenomena. Another finding from the hypnosis literature is that people who are good hypnotic subjects tend to be more left lookers, meaning that when they access, they have a tendency to look up to their left more than they look up to their right. Whereas poor hypnotic subjects have a tendency to be more right lookers, looking up to their right when accessing information. You can check out Kenneth Bauer's work for more on this if you're curious. Now, this is also something else that I noticed in this guy. And he also had a high eye roll. Now, by eye roll, I mean this. If you ask someone to look at you and then move their eyes up, and then while looking up, kind of pressing their eyelids down, you'll notice that for some people, the eyes don't seem to move at all. That's like a zero eye roll. For some people, the eyes kind of look like they're rolling back into the head, like only the whites show. That's a very high eye roll. There's a correlation here between the eye roll and hypnotizability. And Herbert Spiegel, who discovered this, did a couple of studies that showed that in about 75% of the cases, there was a pretty good correlation. In my own practice for a couple of months, or I think it was more than 2 months, but a few months, I would hypnotize people, attempt to evoke various phenomena, and then afterwards test the eye roll. I did it afterwards to make sure I didn't have any confirmation bias based upon knowing the eye roll in advance. And my findings were pretty close to Spiegel's. A little bit less of a correlation, but somewhat close. So this guy also had a very high eye roll. Now, taken in isolation, it's not that good of a tell. But if you add it to the other stuff, it kind of begins to add up. So when I went on stage that day, I didn't really know what I was going to do. I knew I was going to demonstrate something, but I hadn't quite decided upon what. And this woman in the audience spontaneously asked me about spatial or stage anchoring. And immediately I just knew what to do. So I looked at my new friend and I said, hey, would you be willing to demonstrate some deep trance phenomena? And he said yes. And I got a very congruent yes. That's important. So I said to him, now, if you were to stand up, and he did, for each step that you take, the deeper that trance becomes. And if you look at it, you can see that this is a very simple pace and lead. He stands up, and then I tie going into a hypnotic experience just with him stepping towards me. And you can see that he's physically and psychologically responding to this. He's going more and more into a very absorbed, very dissociated hypnotic experience. I also said, remember that stuff you did with James. Now, that's also a suggestion for him to begin to activate those circuits internally. It's a bit like a prime. So when he came up to me, I moved him to the exact same space where he and James did the card stick. And I actually put his hand out in the same position. Now, why did I do this? This is another non-verbal suggestion for him to access his hypnotic capacities, to access the same states that he was in when he did the stuff with James. So by putting his physiology in the same position and moving him to the same space, I'm using spatial anchoring. And then I said, you're standing here, which is a truism. It's obviously true. I have a question for you. What size, breed, and color is that dog there? As I pointed, with some flair, with some drama, with some pause. Of course, I got this from Milton H. Erickson. He used to call it the surprise induction. It was a way for him to sometimes evoke visual and auditory hallucinations on the spot as people moved into his office. Now, the questions, what size, breed, and color is that dog there, all presuppose the existence of a dog. So his mind created a hallucination of a dog and projected it out there. And it was as real as real. Confirmed by his written narrative later. And you can also see that when I suggest that when I snap my fingers, the dog will become twice as big, you can see him kind of jolt back. And you can see his pupils widen and his eyes kind of widen. This is real, non-voluntary physiological responses. For those of you who might be inclined to think that this is faking and role-playing, it's not. These are real psychological, neurophysiological phenomena. There's been in the last 15 or 16 years quite a bit of studies showing that this is real. One famous one is David Spiegel's Believing is Seeing experiment, where he has high hypnotizables and low hypnotizable. And he asks both groups to hallucinate color onto a black and white picture. And you can see that when the low hypnotizable group imagines it, nothing's really happening. But when the highly hypnotizable folks do it, the color processing regions in both hemispheres light up in exactly the same way that they would light up if they actually saw color. Or I should say, created color, since the colors aren't really out there, but it's a product of our brain. But that's also a different topic. So this is real stuff. Then after that, I gave him the suggestion that the next time he opened his eyes, I would be invisible. He would see right through me. And the way you can know that this worked is that when he opened his eyes and I moved, his eyes didn't follow me. If it hadn't worked, you would have seen that quick reflex of the eyes kind of scanning the movement and his eyes following me. But that didn't happen. You can see that his eyes stay in exactly the same place. Also notice his facial expressions and his response when I suggest to him that when I snap my fingers, he'll be able to only see my head. And you can see that he has quite a bit of a amusing experience with that. So I hope this was an interesting podcast and might inspire more people to be a bit more experimental and do some experiments and try stuff. If you have any questions or comments, feel free to put them on the Provocative Hypnosis blog. And until next time, may you have a very hypnotic day.